Heart rate. Heart rate is one of the most well-known medical terms. It is widely familiar with a measure of the heartbeat. The pulse is a critical measure of the heart rate. An extremely slow pulse combined with dizziness can indicate shock and help identify internal bleeding. A pulse that is too quick, on the other hand, points to high blood pressure and cardiovascular problems. With practice, it is easy to take your own pulse and those of other people. But what is the pulse? Why is it important? And what is the best way to find and measure the pulse? Arteries run closely to the surface of the skin at the wrist and neck, making the pulse particularly easy to find at these points. Simple steps needed to take the pulse at the wrist. This is known as the radial pulse. Turn one hand over so it is palm side up. Use the other hand to place 2 fingertips gently in the groove on the forearm, down from the fold of the wrist and about an inch along from the base of the thumb. When the position is right, you should feel the pulsation of your heart beat. The pulse can also be found on the neck using 2 fingers in a similar way. Gently press into the soft groove on either side of the windpipe. This is the pulse running through one of the carotid arteries. These are the main arteries that run from the heart to the head. Less easy places to find a pulse are behind the knee, on the inside of the elbow when the arm is outstretched, in the groin, at the temple on the side of the head, and on the top or the inner side of the foot. The pulse rhythm, rate, force, and quality are assessed when palpating pulses. The normal pulse rhythm is regular, meaning that the frequency of the pulsation felt by your fingers follows an even tempo with equal intervals between pulsations. If you compare this to music, it involves a constant beat that does not speed up or slow down, but stays at the same tempo. Thus, the interval between pulsations is the same. However, sinus arrhythmia is a common condition in children, adolescents, and young adults. Arrhythmia involves an irregular pulse rhythm in which the pulse rate varies with the respiratory cycle. The heart rate increases at inspiration and decreases back to normal upon expiration. The underlying physiology of sinus arrhythmia is that the heart rate increases to compensate for the decreased stroke volume from the heart's left side upon inspiration. If a pulse has an irregular rhythm, it is important to determine whether it is regularly irregular. For example, 3 regular beats and 1 missed, and this is repeated. Or if it is irregularly irregular, meaning there is no rhythm to the irregularity. Irregularly irregular pulse rhythm is highly specific to atrial fibrillation. Atrial fibrillation is an arrhythmia whereby the atria quiver. This condition can have many consequences, including decreased stroke volume and cardiac output, blood clots, stroke, and heart failure. The pulse rate is counted by starting at 1, which correlates with the first beat felt by your fingers. Count for 30 seconds if the rhythm is regular, and multiply by 2 to report in beats per minute. Count for 1 minute if the rhythm is irregular. The pulse force is the strength of the pulsation felt when palpating the pulse. For example, when you feel a client's pulse against the fingers, is it gentle, Can you barely feel it? Alternatively, is the pulsation very forceful and bounding into your fingertips? The force is important to assess because it reflects the volume of blood, the heart's functioning and cardiac output, and the artery's elastic properties. Remember, stroke volume refers to the volume of blood pumped with each contraction of the heart. Thus, pulse force provides an idea of how hard the heart has to pump to work blood out of the heart and through the circulatory system. Pulse force is recorded using a 4-point scale. 3+ for a full bounding pulse, 2+ for a normal strong pulse, 1+ for a weak, diminished, or thready pulse, and 0 for an absent or non-palpable pulse. Practice on many people to become skilled in measuring pulse force. While learning, it is helpful to assess pulse force along with an expert because there is a subjective element to the scale. A 1+ force, weak and thready, may reflect a decreased stroke volume and can be associated with conditions such as heart failure, heat exhaustion, or hemorrhagic shock, among other conditions. A 3+ force, which is a full and bounding pulse, may reflect an increased stroke volume and can be associated with exercise and stress, as well as abnormal health states, including fluid overload and high blood pressure. Pulse equality refers to whether the pulse force is comparable on both sides of the body. For example, to palpate the radial pulse on the right and left wrist at the same time and compare whether the pulse force is equal. Pulse equality is assessed because it provides data about conditions such as arterial obstructions and aortic coarctation. However, the carotid pulses should never be palpated at the same time, as this can decrease or compromise cerebral blood flow. Now that you have a target, you can monitor your heart rate to make sure you're in the zone. As you exercise, periodically check your heart rate. A wearable activity tracker makes it super easy, but if you don't use one, you can also find it manually. Take your pulse on the inside of your wrist on the thumb side. Use the tips of your first 2 fingers, not your thumb, and press lightly over the artery. Count your pulse for 30 seconds and multiply by 2 to find your beats per minute. If your heart rate is too high, you're straining. If your heart rate is too low and the intensity feels light to moderate, you may want to push yourself to exercise a little harder, especially if you're trying to lose weight. When you work out, you are doing too much or not enough. There's a simple way to know. Your target heart rate helps you hit the bullseye so you can get maximum benefit every step, swing, and squat. Knowing your heart rate or pulse can help you track your health and fitness level. Your resting heart rate is the number of times your heart beats per minute when you're at rest. A good time to check it is in the morning after you've had a good night's sleep, before you get out of bed, or grab that first cup of coffee. For most adults, between 60 and 100 beats per minute is normal. The rate can be affected by factors like stress, anxiety, hormones, medication, and how physically active you are. An athlete or more active person may have a resting heart rate very low. These expansions rise and fall in time with the heart as it pumps the blood and then rests as it refills. The pulsations are felt at certain points on the body where larger arteries run closer to the skin. If you have any concerns regarding your heart rate, please speak with your healthcare provider. It is easy to measure a pulse, and it can give useful indication of your state of health.